Great. All right. Thank you for attending today. Welcome again to the Community Innovations Request for Proposals webinar. This is the second one. We did the first last week. And my name is Colby Daly. I'm the Managing Director here at the Build Healthy Places Network. And we're a national organization that's based in San Francisco with a mission to shift the way organizations work across the health, community development, and finance sectors with the goal of collectively advancing equity, reducing poverty, and improving health in neighborhoods across the United States. Our hope is that the Community Innovations Opportunity, what we'll be talking about today, will help us move toward those goals. I'm sure all of those of you on this webinar would agree that the roots of poor health and poverty are the same. And for decades, healthcare and community development as sectors have been working in the same places, sometimes even with the same people, but not together. The work that we do through our convening, translating, training, and highlighting the common aims that these sectors have, we've really found that many organizations in each sector are ready and interested in engaging with each other. We've also learned that many of the smaller and lower resource community development corporations, or CDCs as we call them, have not been included in the national dialogue. And this has resulted in less access to the tools and networks that really can help facilitate their developing a cross-sector strategy or the capacity to engage healthcare successfully in their neighborhood investment efforts. So this program, Community Innovations, is really designed to reach smaller cities in low resource areas and those organizations focused on health equity, racial equity, and the social determinants of health. And I'll explain some key terms in a minute. Community development corporations, or CDCs, that serve low-income communities and communities of color are the organizations that are invited to participate in this opportunity. I have the pleasure of working on this project with my colleagues. As Managing Director, I oversee organizational strategy and growth, the business operations and program implementation here at the network. And I'm going to pass the mic now to my colleagues so that they can introduce themselves.
Hi, everyone. Excited to be here today and talk about this opportunity with you. I'm Colleen Flynn, and I'm the Director of National Programs at Build Healthy Places Network, and I oversee program and project implementation and partnership development for the network. And with that, I'll turn it over to my colleague, Renee.
Hello, thank you, Colleen, and good morning, everyone. My name is Renee Badruzaman. I'm a program manager here at Build Healthy Places Network. I operationalize and implement our place-based strategy work, and I'm excited to be here. I have the privileges of working on this project with Colby and Colleen, and thank you so much for joining us. So as the agenda for this webinar, our goal is to review the main information for the Community Innovations Request for Proposals. We'll provide an overview and background of the opportunity, the eligibility guidelines, and we'll go over the award commitments or awardee commitments, including application questions and how to submit and how to apply. We'll look at some key dates and spend the last 20 minutes or so dedicated to your question and answers. Okay, so for a few housekeeping items, here are some tips. If you're having any technical issues, please use the chat function on the lower left-hand side of your screen, and feel free to put that in as anything comes up. If you have any question and answer questions, please use the Q&A function to submit those. That way we can go ahead and answer those as the webinar is going on, or save those until the end. So again, if you have any questions during the webinar on the RFP itself and eligibility, feel free to put those in the question and answer section. We will be recording this webinar today, and as a reminder, all of our participant lines are muted. During the question and answer section at the end, we'll go ahead and ask you to unmute yourself so you can ask your questions. And I think that is all that I have for the housekeeping. And I think I'll turn it over to you, Colby, to give an overview of the opportunity itself.
Great, thanks, Renee. So Build Healthy Places Network, with funding from the Kresge Foundation, is excited to launch this program. And our goals here are to deepen the outreach to and learning from CDCs that serve low resource communities and historically marginalized communities. We actually have a three-pronged goal. One is to enhance our understanding of how best to support organizations that are local organizations' cross-sector efforts in these communities. Also to connect local organizations to other peer organizations in the larger national dialogue that we've been part of, as well as providing resources and tools. And then also the third is to embed capacity within your organizations to undertake health strategies and engage with healthcare in a sustainable and ongoing way. I want to go over a few key terms here, and it's really to ensure that we're using the same definitions and are clear about what we mean by health strategy or social determinants of health. We have included a glossary of terms on the RFP webpage, and I wanted to highlight a few key terms now, and I'll just acknowledge that this slide has a lot of words. Again, these definitions are in the RFP, and also we'll be sharing these slides on our website so that you'll be able to access them there. Quickly to go through them, what we mean by low resource areas. These are areas that have experienced historic marginalization and disinvestment, resulting in economic challenges, financial insecurity, and lack of access to resources, affordable and quality healthcare, stable housing, good jobs, and opportunities for prosperity. We actually are using that definition, from NeighborWorks America, which is another national organization with a network of local CDCs. In terms of health strategy for this project, we define it as an explicit and intentional effort to improve one or more of the social determinants of health in collaboration with a healthcare partner. What we mean by a healthcare partner are organizations that deliver healthcare, medical, or behavioral health services, such as hospitals, healthcare systems, health insurance plans, accountable care organizations, and managed care organizations. The last one here to mention are what we mean by community development corporations. This definition is one we're using that's provided by the Democracy Collaborative, and there's a link to that in the RFP as well. But these are nonprofit community-based organizations focused on revitalizing the areas in which they are located, typically low-income, underserved neighborhoods that have experienced significant disinvestment. And I'll pause there. You can read the rest of the definition there, and that's what we're using for purposes of this RFP. Colleen is going to go into examples of what these CDCs look like, as well as other community organizations that are eligible for this opportunity. Before we go on, I want to actually move to a quick explanation of how we think of social determinants of health and as they relate to social needs. Both are critical for communities to be healthy. We think there's a significant difference and distinction between them, and our focus is on social determinants and how we're continuing to move cross-sector partnerships further upstream. With social needs, we see these as individual social needs and interventions that are really addressing individuals. The graphic that you're seeing on this slide uses a metaphor of a river to describe the difference. The upstream factors that bring downstream effects include improving the underlying social and economic conditions in communities to foster improved health for all. Upstream interventions could include affordable housing with on-site support services, grocery stores and food deserts, community centers with workforce development programs, comprehensive childcare and educational facilities, small business support, and more. So these social determinants of health have a community level impact. Whereas social needs are more at the individual level and are treating conditions that are caused by low access to the upstream determinants of health. Although the healthcare sector has increasingly engaged in identifying and addressing social needs, again, which go beyond a patient's medical needs, but have had, these systems have had more challenges addressing the factors far enough upstream to reach the environmental and social conditions at the community level. So just to put a point on it, social determinants of health for this project are the conditions in which people are born, grow, live, work, and age, including within the health system. Specific social determinants of health include economic and housing stability, employment status, educational attainment, access to healthcare, access to healthy foods, exposure to crime and violence, and environmental conditions. Again, these are community level. So with that, I'm going to turn it over to Colleen to talk more specifically about what this opportunity is.
Thanks, Colby. So to give a little bit more detail about the opportunity, first, it's an 18-month program for up to 8 eligible organizations that are motivated to engage healthcare partners in their neighborhood revitalization work. The up to 8 eligible organizations is because selected organizations will be awarded up to $40,000 to support staff or a consultant trained by the network to lead their healthcare engagement. So we're not sure if we'll have 8 organizations or if that pool will be a little bit less. It'll just depend on the applications we receive and kind of what the needs are. You'll also receive $60,000 of in-kind technical support provided by the network by our team, and facilitated connections to national network of peer support that we have just through the years have collected different experts from around the country that can also help support this work. Next slide. We wanted to go a little bit into our menu of services since you will have access, awardees will have access to these services and consultants that can help advance collaboration with healthcare. And we'll be training a pool of consultants that you could utilize the $40,000 to help support your healthcare engagement. So some of these are, one is a landscape or market analysis, and this is supposed to be analysis that can be tailored to help identify healthcare partners in your particular community and look at their pain points and initiatives and priorities and investment history, and kind of look at the inequities in your neighborhood, other initiatives that might be going on that you might be able to leverage, getting kind of a snapshot of the community and a real analysis, particularly on the healthcare partners. Another is case making. So the network or consultants could provide customized case making to help your organization with messaging and language and knowledge needed to really engage healthcare. Sometimes that can be the hardest step. So we can provide that case making help through, a lot of times we end up doing a pitch deck for organizations that they can use when they talk to healthcare during meetings. We can help broker connections, either the network or consultants, and can help curate conversations that really foster collaboration. It could be on this particular project, on a fund that you might want to create. And the goal is really to map out an action plan so you can come up with shared priorities, project development, and kind of next steps. And relationship management is somewhat similar. It's just a kind of an ongoing way to help provide support to just develop and manage that relationship with healthcare, to ensure that there's successful, sustainable cross-sector engagement that will last a long time. And then last is we can provide different trainings to build capacity for cross-sector collaboration. We have different tools and resources like a jargon buster, something about the return of investment on community development and the impact on health, just to provide some effective health engagement strategies that can help lead you along the way. Next slide, please. So I'm going to go over some of the eligibility requirements for applying for this fund, this grant opportunity. One is to be a 501(c)(3) organization, so a nonprofit organization. And then two, as Colby mentioned, is either being a community development corporation that's serving low-resourced area and historically marginalized communities. And Colby went over the definition of a community development corporation. So definitely think about if you're, a CDC helps to develop and manage affordable housing, grocery stores and food deserts, community centers, childcare, educational facilities. So they're kind of doing that bricks and mortar work along with advocacy and support services for residents. You could also be a nonprofit organization that engages community members to plan and implement neighborhood improvements that impact social determinants of health. And I'll elaborate this on another slide. But the goal is that this organization is overseeing and leading the neighborhood revitalization efforts with community members. Another is to have an explicit racial equity and diversity and inclusion lens. Also committed to partnering with us, the network, to advance beginning or early stages of collaboration with healthcare partners. And then, as we talked about, has a dedicated staff person that will serve as the lead on the project. So the staff person can manage the overall project and any additional staff as needed. And then, as we mentioned, you could also hire a consultant to support the projects. We would still like to have one staff person be the lead on the project. And then lastly is to demonstrate leadership buy-in. We'd like a letter of support from your president, CEO, executive director, board chair, or equivalent. So just to drill down a little bit on nonprofits that are eligible, we're giving one example of that. So a national organization called Purpose-Built Communities, they provide no-cost long-term consultation to support communities working to break the cycle of intergenerational poverty. And they have a network of sites all over the country. And one of those is 75 North in North Omaha. And what 75 North was created to do is to facilitate, as we were talking about, the revitalization of healthy, sustainable, mixed income community in the Highlander neighborhood. And so what 75 North concentrates on is they have one pillar that does cradle to college educational pipeline. So children ages 6 to 4 years are served in the Early Learning Center that opened in 2019. And this is a large center that's next door to an elementary school. And they have a community partnership agreement with other public schools to strengthen schools in the neighborhood and provide a continuum of high quality educational and learning opportunities for neighborhood residents. The second is mixed income housing. So 75 North is actually developing and planning to develop more mixed income housing for both sale and rent. They've already created around 300 units and have more units underway for 2020. Last is community health and wellness. So they created a 65,000 square foot space that serves as a community accelerator. They have plans for a rental venue space here, family wellness center, food court, technology and lab, and community room. So they're actually building a community space and kind of a hub for health and wellness in the neighborhood. So now we'll go over just a little bit about the awardee commitment, so what awardees would be committing to over the 18 months. One, as we already talked about, is to work on a discrete project to advance health strategy with healthcare. Awardees will designate a staff person, as we talked about, to serve as the lead. We will ask awardees to complete a pre and post assessment on capacity and progress towards partnership through the 18-month period. Oh, and as we talked about, awardees may hire a local consultant or a consultant in the network's trained pool to help you all kind of think about and craft your strategy and implement your strategy to engage healthcare. Another commitment is that we'll ask awardees to engage with a network of peers, so the other awardees that are part of this cohort, and advisors, and share challenges, ideas, and solutions that you've come up with to engage with healthcare. And the way that we'll do this is that we'll have webinars, and in some cases smaller Zoom salons. And when we say salons, we mean that the network will help facilitate and cultivate less formal, friendly online conversations with peers and advisors, where you can really get into the nuts and bolts of what you're grappling with and how to get to the next step. And now I'll turn it over to Renee to talk about how to actually apply.
Great, thanks, Colleen. And as a reminder, if you have any questions, and if you're just joining us, please use the question and answer Q&A function on your screen, so that we can compile all those and make sure that we answer those questions. So again, thanks for joining us. How to apply? Well, for step one, download the application template. There's a link here on the slide, and we'll go ahead and put that in the chat function as well. And this is an important step because it has the information for the following steps. All of those can be found on the RFP webpage. So after you've downloaded the application template, step 2 is complete the About Your Organization, project scope, and community profile, so we can know a little bit more about your community and your organization, and some helpful tools to use, and some guiding questions are also on the application in the RFP webpage. Step 3, fill out the questions that support principles for building healthy and prosperous communities. So in this application, there are 5 principles that have 2 to 3 questions each, and we'll ask you to answer those related to your proposal. Step 4, attach the additional required document, which is a letter of support from, as Colleen had mentioned, from your president, CEO, executive director, board chair, or equivalent from your organization. And step 5 is email all those documents per the instructions by March 18th. So again, we'll ensure that the application link is in the chat, and it can also be accessed on the RFP webpage. So now we'll spend a few minutes going over our principles for building healthy and prosperous communities that are field informed and have and the application from which the application was based on. So for the evaluation of the proposals, the advisors and evaluation team will be looking for efforts that exemplify the 5 principles for building healthy and prosperous communities. In the first category, in Principle 1, we're asking that applicants demonstrate how they work directly with communities impacted by health inequities in historically marginalized areas. How they prioritize those efforts identified by the community members themselves, and how they amplify voices of diverse leaders from the community. Preference will be given to eligible applicants that are community-led and have demonstrated trust from the community. And we'll go ahead and put the link to these principles also in the chat function. For Principle 2, embedding equity, we're asking applicants to demonstrate an intentional and explicit goal to identify or minimize barriers to racial and health equity. Meaning, how will your work apply an equity lens throughout the project? In Principle 3, mobilizing across sectors, we want to know how the focus of this emerging health strategy coordinates across community development and healthcare sectors to address the social determinants of health. And that can include sectors like public health, business, and government. In Principle 4, increasing prosperity to improve health. In this section, applicants are asked to answer questions that demonstrate a track record of successfully community development strategies that build prosperity, opportunity, and wealth and economic mobility for your communities. Lastly, Principle 5 will ask applicants to describe how this project is both outcomes focused and feasible within the 18-month timeframe. The overall goal for this partnership with healthcare is to be sustainable, have an impact, and commit to the long term. So as a reminder, the questions are on the RFP webpage and the application template. Just a note on the format, there will be 2 to 3 questions per principle, and please keep responses to 2 to 3 sentences per question. And again, all those instructions can be found on the template itself. So for key dates, the awards, the applications are due in a little less than 2 weeks on March 18th. April are when awards will be announced for up to 8 organizations, as Colleen had mentioned. May 1st is when the official project start is, and then 18 months from then is October 31st, 2021, which the project will conclude. Okay, so thank you. We're going to move into our question and answer section. So please, as a reminder, use the Q&A feature. If any of that information, anything regarding eligibility or any of the definitions, please feel free to ask your questions now. And I'll turn it over to Colby to help facilitate and moderate the section, but we'll all be here to field your questions.
Great, thanks, Renee. And so I know that there already are some questions coming in. You can also ask a question live. All lines are currently muted. To ask a question, I believe folks either they raise their hand or they unmute themselves, and then we can make sure your question is heard. And you're certainly if you're more comfortable using Q&A, we can use that as the place. A couple of times, I think I've seen a couple of questions just about a lens on equity. And just to reiterate what Renee was saying about the work, we want to make sure that it is addressing barriers to equity and advancing health equity, racial equity, and inclusion in your community. So we'd like to see that as an explicit goal of the project and the work that you do. A couple of other questions here. There's one about dedicated staff person to work solely on this initiative. Shannon, you asking, or to be the point person for the organization, but able to work on additional projects. We know organizations, folks wear multiple hats in an organization. What we envision for this is that there is a designated person to coordinate the work, whether that person is also the award funds can be used to support that person's time to advance this project and advance the healthcare strategy within the organization. It can also be used to bring in a consultant, either one that's sort of trusted in your community to advance the work, or you can draw from the pool of our trained consultants to really move the work forward. We are in both cases asking that the designated person, while they may be wearing multiple hats, be also dedicated to moving the work forward.
There is someone who raised their hand, so maybe if that's okay.
Great, thanks, Renee.
Yeah, okay, Dora Williams has a question, and I'll go ahead. Dora, do you want to go ahead and ask your question?
We can't hear you, Dora. Maybe, should I go to another question? We can come back.
I think so. And I'm getting a prompt from Zoom that I'll need to promote Dora to a panelist to speak. So I'm going to go ahead and do that. So I think, Dora, you have an opportunity to speak now, if since you are a panelist now.
Not hearing.
Not
so
hearing that.
So let's quickly just move forward, and maybe Dora can join us in a minute, or Dora, you can feel free to type your question in the Q&A. There's just a question about how many are tuned into this webinar. So we have about 45 attendees currently, and on our last webinar we had about 80. Is that right, Renee? Mm-hmm. Yeah, so a lot of interest here. There's a question about a sweet spot for population size. I would say that we're looking for a range. Our focus is on, and I'm gonna ask Colleen or Renee to add to this, but we would like to add, make sure that we're reaching communities that might not already be tapped into the national dialogue. So that is smaller cities often. It could also be low resource organizations that are working in a more urban area, but haven't been able to access these tools and resources because of capacity. So Colleen or Renee, would you add to that?
I would just add that if you are, that the most important point is that you're working in a neighborhood that has been historically marginalized and is low resourced, and you could really use some support and capacity to engage with healthcare.
Mm-hmm. Great. There's a question about whether or not a consultant is required if we have someone internal who would oversee the partnership. No, a consultant is not required. The network, our team, would be working with the staff person to help advance collaboration. It looks like there are a couple of questions about the template and looking for where on the template you might put your name and address. Renee, would you provide some direction?
On where the, I'm sorry, on where the template is?
Where it's located, and then also how to include organizational information on the template.
Yes, gotcha. Thank you. So the application template is on the RFP webpage. Everything is all on one webpage for safekeeping. So you can find it there, and there's some additional information about what your organization, what we're looking for about your organization. We're trying to keep this to about 120, or excuse me, 2,000 characters, but we want to know who are the community that you're working with, what has been your track record and history working with the community, and some additional questions. So all of that can be found on the RFP webpage, which I believe we have chat. We put that in the chat now.
Thanks, Renee. Yes, so there is a link in the chat box. Colleen, there's a question here from Chloe. I want to confirm it's appropriate to apply for a project to deepen existing relationships between the CBO and health providing institutions. It seemed like a lot of the language was geared toward community-based groups in very early stages of building these cross-sector relationships. Would you mind responding to that?
Sure, Chloe. So a couple of thoughts. One is just making sure that your organization is a community development corporation or a nonprofit that's really focused on neighborhood revitalization, referring to the 75 North example. And then secondly, yeah, if your community development corporation is a little bit further along in the engagement with a healthcare partner, that's fine, and we can just help advance that collaboration. We do want to make sure it's a healthcare institution, so that it is a hospital, a healthcare system, a healthcare plan, so that we're really thinking about advancing collaboration with a healthcare partner. Public health and other health entities can be really helpful partners as well and be a key stakeholder. Our goal is to advance collaboration with the healthcare sector for this particular grant opportunity.
And thanks, Colleen. And just sort of building on that, there's a question about whether or not organizing low-income tenants to advocate for their housing rights would be an example, whether that would be an example of a discrete project.
And I actually know Ron Zach. So hi, Ron Zach from Fifth Avenue Committee in Brooklyn. So the answer is yes. We've actually seen that we're working in Coachella Valley, for instance, with a community development corporation. And as a first step, hospitals in that area are joining forces with community development to advocate for more affordable housing in a particular catchment area, because there's actually been a reduction in affordable housing in that area and no new housing built. So we see that as kind of an initial entry point to build trust and create a partnership. And our goal would be to see that partnership grow and turn into something long-term, where maybe in a couple of years or in a year, there's actually a hospital investing in affordable housing or a community center and putting some of their treasury money to work. We do think advocacy could be a first step.
Thanks, Colleen. Renee, I wanted to check in with phone participants. Are there any live questions?
No live questions. I'm working with Dora in hopes that Dora can hear us and can speak up when she has the floor, but no other questions. Feel free to raise your hand and ask your question live. We would love to hear from you all too, and I'm happy to hear that.
Great. Well,
you guys hear me?
Oh, yes.
Is that Dora?
Yes, you can hear me now. Oh, great. Having a technical difficulty there. I could probably use some of that help right now. For in kind. Good afternoon. I have a question about healthcare network. Would a community, I guess it's a healthcare facility, and it's small, and it services the community. I guess more like a urgent care, or not urgent care. I'm trying to think of what, I guess it would be like urgent care or a facility that you can go to. You can have a primary care physician there as well.
You're looking for maybe acute care?
No, it's not acute care.
So Dora, is your question just about different types of potential healthcare partners?
Yes, that I was trying to find out if this particular facility would fulfill that requirement. It
Yeah.
does provide services to the community. Like I said, you can you can have a healthcare. You can have
Yeah.
family doctor there. You can have I'm kind of lost for words today. You can it would be on an emergency, not real emergency, well, emergency basis. If you went there and it's something, then they would just, of course, send you to a hospital. But
I think
what are the requirements for to fulfill this requirement as a healthcare network partner?
Thanks for that question, Dora. I think it's a great question. Renee, Renee or Colleen, do you want to answer that?
Sure, Dora. I think that it might be helpful if offline you could share a link to the entity you're referring to Renee. My assumption is that yeah, it might be some type of like health center. So it might not be the greatest fit for this, but we would like to take a look and make sure. So if you could send a link to Renee, her email address is in this webinar and on the RFP page, and we'd be happy to look at that.
Okay. All right. Thank you.
Yeah, absolutely. And please, Colleen and Colby, add to this. But the purpose of this opportunity is to support an emerging health strategy with a partnership with healthcare, and that doesn't necessarily have to be all figured out up front, but an identification of who that health partner is really important to include. So that's some of the support and that this opportunity can provide, is moving that along. So that will be helpful to, I think, figure out before.
Yeah, and I guess one thing to add is that the reason why we're focusing on healthcare systems or healthcare plans is usually, you know, they might have treasury money or other monies that can be utilized, or community benefit money. So we're trying to find kind of bigger systems that could invest in neighborhood revitalization efforts.
Oh, okay. So I would guess that the facility I'm talking about would not necessarily be able to. I mean, I think that if there were money to be invested to make the partnership work, would be appropriate. But if you're just looking for someone that would be able to
yeah, well, let's talk.
The partnership.
Yeah, let's talk. Let's talk offline, and we can, if you can connect with Renee, we can set up a short call. Yeah, thanks for your question.
It's a great question. And I see a number here coming through the chat box or the Q&A box. So let's, I'll run through some of those questions. Rebecca Rubin is asking, can funding be used to give an organization the capacity to accomplish the principles, or does the organization already need to be accomplishing the principles and funding is just to propel the org further? I would say, and I'm asking my colleagues to add to this, that we're looking for early stage. So, you know, we'd like to think that the organizations we're working with, the awardees, agree with the principles and are working toward them sort of through their mission already. The project itself can be in a very early stage, or sort of even a thought in the organization's, a concept in the organization's strategy. So, so we're looking for that. Does not, we are not looking for a project that's in an advanced stage or already out the door. Anything to add, my colleagues?
Yeah, Renee, do you want to go? Yeah.
Sure. I mean, just to highlight, yeah, I think that's great. I think to highlight or underscore is that that the kind of suite of services or the menu of services that the network can support and provide, and a consultant can provide, will support an emerging health strategy, so that becomes more sustainable and long term. So projects that are more advanced may not need that level of support, and so we're trying. That's why we're outreaching to. Folks who in communities that have been low resourced and historically and marginalized historically, right? And why this is a great opportunity for that.
Great. John David has a few questions just to acknowledge those. Does the dedicated staff person need to be identified? That's really helpful if you have somebody already on staff who can run this project forward. If you're in the middle of hiring that person, that's important for us to know. We're not asking for resumes at this point. And we're not asking for 501c3 documentation. We just want eligible organizations to be 501c3s. And if you have a question about that, you can certainly reach out to us and let us know. One question that came in through the chat box that I want to acknowledge as well was one around that there's a focus on CDCs as it relates to housing, community centers, workforce development. We mentioned food desert and food access, and the question is, could we elaborate on the kinds of healthcare partnerships related to food access that might be appropriate? One example that comes to mind is actually a health system that's helping, working with a local CDC and a CDFI to invest in grocery stores and food deserts. So that's one example. I think there are also examples of healthcare having land that they can use or properties that can be repurposed to provide to put in place grocery stores and food deserts, or other food systems sort of additions to within neighborhood revitalization. So I hope that's helpful. Colleen or Renee, anything to add there?
Yeah, I think that's right. I think in some cases they're actually co-locating some of those services. So with affordable housing developed next to a grocery store, or even a co-op, doesn't necessarily have to be a grocery store. It can be a smaller food access project. But that's something that increases access to healthy, affordable food to residents that are underserved.
Great. Question about whether a project would be considered as finishing a pilot phase and moving to implementation. That's a great question. Does either of you have any thoughts on how to answer this? I think it would be useful to talk to you to find out a little bit more about where your project is, to be able to answer that. So you can reach out to Renee.
Agreed. Yeah.
Okay. A question about how new an organization is. To answer your question, Lisa, there's no eligibility criteria around how long you've been operating. So if you're a fit and meet the criteria, then you would be eligible. This is our first year implementing this program. This is a grant from the Kresge Foundation that is allowing us to move it forward. So any of the awardees this year would be the first to be on that list of the program participants. I will say, however, that we have been working in communities and with national organizations over the last several years. So these tools and resources that we have are being tested continuously in the field, and we would be putting them to work through this program and iterating on them as well based on what we learn. There are a couple of questions I just want to see in the chat box to see if there's anything I'm missing here. Thanks for everyone using the Q&A box. We are asking organizations to think about a healthcare engagement strategy. So part of our process for awardees is really helping them identify who those healthcare partners are. We are hoping that in the application you can identify who you think might be those partners, and it could, there are a number of healthcare organizations that we would consider potential good partners for this work. So we would work with you to identify who those partners could be. I think we've got them all here, and just to reiterate, partnerships do not have to be solidified. The point of this project is to really help identify who those partners could be, and help craft a strategy for engaging those healthcare partners. Any other questions? It's always great to give people time back in their day, so we don't have to go the full hour. Again, this is being recorded. We'll post the recording online along with the slides. The deadline is the 18th for the applications. Renee has her information on the slides there, so you can reach out to her directly with any other questions you may have. And if that's it, I think we can say goodbye. Anything to add, Renee or Colleen?
No, just thanks for joining, and we're excited to see who decides to apply. And yeah, I think it's going to be a really, really great, interesting project to work on.
Yeah.
Likewise. Thank you so much for listening and your interest in the Community Innovations Opportunity. Feel free to reach out if you have any other questions or concerns as you're filling out the application. Deadline is March 18th, and we're really looking forward to hearing from you.
Thank you.